Hello, this is exercises 11 through 38. We're going to be beginning with some of the release type movements. The first one being the upper spine and neck release. So that will just be using the foam roller along the length of your spine and just sitting there and letting muscular fall to the side. Just remember to breathe properly and keep a neutral hip, okay? Mm-hmm. And you should, okay, there you go. Okay, so you do that one. And then the next one, I'm going to get you to put your legs up there like we talked about. Yeah, I know.
Good times.
It will begin to feel nicer. Once your body gets used to this, it will get better, okay? All right?
Okay.
And then the next one is going to be release. Now, this is a fairly hard ball. Should begin with something a little bit softer. But again, most of these use his body weight, and I'm here to assist him, so we don't have to worry about him applying too much pressure. Okay, so this one, just use, keep, his legs are elevated, so he can decide on the pressure. So this ball is going to go right between his scapula, and it's just, he's got his arms here to help him. He's gonna release his upper body weight on it to the appropriate amount that he can handle. Okay, so there you go. And you're gonna have to position it, have your arms ready, okay, to catch you. I know.
Yes.
Okay. Yeah. I know, it's only once, and we just release it. I know, okay?
Okay.
Alright, yep.
Yeah.
Okay, and then the next one, give you a little bit of relief. We're going to do the hip flexors release. The hip flexors are a big thing that we need to release. And so this is going to go right at your hip flexors. So you're going to find your hip bone. You're going to put this right below it. And then you're just going to lie on it. And then you can either keep your leg, your opposite leg as support, or place yourself based on here, and I know you have trouble with lumbar extension, so we're going to put you here, and you just kind of grind and find that sore spot and put appropriate amount of weight for you to handle, okay?
Okay.
These are the hard ones, we're almost done. Okay? You know. Alright, so you're going to hold that for 30 seconds, and the pain will dissipate, I promise, okay? Alright, so, and then he's going to do that on both sides. Okay, so stand up. And the next one, I'm sure almost everybody's done this at home, but this is actually we're going to do this on your lumbar spine, okay? What you're going to do is, you're going to put it on either side of your spine, so like your erector spinae, and we're going to just kind of go up and down on the wall, using it as much pressure as you need, okay?
Yep.
On either side of your spine, not right on your spine. Yeah. You gotta find that sore spot. I need your feet. There you go. Good. Okay, and then so he'll do both sides there. All right. Good. Okay, and now we are going to stretch his pec minor. Okay, now we're beginning the stretching portion. It's going to be that same one, okay, but I really want you to put this up to the base of your skull, kind of where my ponytail always sits. Okay, and then you're going to let your arms fall forward. I want you to feel the stretch in your pecs, okay? Because of his rounded shoulders, we know that he's got tightness in his pecs. Okay? In line with your spine and neck, remember? But on the ground.
Okay.
It's okay.
Oh, this one.
Yeah. But remember how it was lower? We want it up to here.
Oh, gotcha.
Okay.
Yeah.
I can help you. Okay. So I want you to feel it more in your shoulders. In your shoulders.
Yeah, I can.
In your chest.
There.
Okay, arms, snow angel. There you go.
There we
Can you feel it there?
go. Yeah, I can.
Okay, good. Okay, now we're going to do a cervical flexion. This is kind of the assisted or the neuromuscular stretches. So what you're going to do, Tyler, is you're going to grab your head with both hands and kind of bring it forward as much as you can, but I need you to I want you to kind of do it in a segmental way, because when we did the muscle firing pattern assessment, we need you to do it slowly, and we need you to hold it in its end range of motion, okay? Because we need you to become more flexible in all of your neck. There you go. Nicely done. It's great when your clients listen. Even better when your boyfriend listens. I know it hurts, okay? Now this one is for some more neck muscles, your scalenes, your anterior ones right here, that we know are doing jobs that it shouldn't do. Okay, so you're gonna have both arms out to your side, and, yep, no, just out.
Okay, got you.
And then opposite hand, opposite side, and just kind of pull your head and look the other way. Okay, now you're gonna have to hold it. Actually go back and forth for 10 seconds. Okay, no, like this. So straight, and then back 10, and then for 10 seconds, back and forth. What we're trying to do is, this is almost like warming up the muscle, because for 20 to 30 seconds, we're also gonna hold it. So back and keep, okay, good. And now you're gonna hold it for 20 seconds. Now the reason we're doing the neuromuscular stretching is because he's had these dysfunctions for so long that the communication between the muscles and the nerves is kind of, it's been disrupted. So by stretching and getting these muscles to their proper length, which means that they'll be communicating better and doing the jobs that they're supposed to be doing. Okay? And some of these stretches I picked for a specific reason, so he can do them on the job site. It is a lengthy program, so if he can do some while he's at work or at lunch, I think it will be great. And now we're going to do an assisted shoulder flexion, because his shoulders are a serious point of contention. Okay, so I want your head here, actually, okay?
Wait.
This way. Okay, yeah. A little bit more. There you go. Okay, all right. Now we're just going to take one shoulder at a time, because we know, especially with shoulders, that there's going to be a dominant side. Okay, so have both your arms out to your side. And now we're going to bring up your shoulder, okay? And we're going to bring it back. Can you? Yeah, there you go. Okay, but so then we're going to go back and forth for 10 seconds, okay? Just you're going to get it warm. And then, okay, are you ready?
Yeah.
Because we're going to hold that at the end point of its range of motion to try and get it, yep. Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Great.
Oh, it feels way better.
Okay, and he says it does feel way better, actually. It's just, you have to, by explaining clients that there will be moments of pain, but because we know what we're doing, we're trying to isolate that muscle and to get it to do what we need to do, whether that be inhibit with the foam roller or to lengthen with just static stretching and neuromuscular stretching. Okay? The next one to actually get his whole superficial back line will be the lumbar flexion squat stretch. Okay, so what you're going to do, Tyler, is this, and I'm going to hold you. So you're going to get down as much as you can. If you need to spread your legs a little bit just to get higher, and then I'm going to hold you up here, and we're just going to get lats and lower back. Okay? So do that. Yep, just kind of like the NASM squat assessment. Okay, and now sit back. There you go. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Yep.
Okay. Then we're going to do an anterior stretch. And now we're really getting the back and the shoulders. Okay, so this is a very simple one, Tyler.
Mhm.
So just here, and you should feel it in the kind of the same spots. Okay?
Like this?
Yeah. Do you feel it in your lats? Right here?
Yeah, you can do it there.
Okay, good.
Yeah.
All right, and then the next one, we're kind of on the ground. These are nice ones. Okay, so you're going to do an assisted lumbar flexion, which just means tuck your knees and kind of roll back and forward, okay? So straight down and then grab your knees, okay? That's for your lumbar spine, your lower back, okay? And then we're going to move into a lumbar rotation. Grab it, perfect. Okay, and you would do that one 3 times, holding for 10 seconds, okay? Now lay back down. And then we're going to, this is a lumbar rotation. So what I want you to do is take one leg over the other, keep your arms out to your sides, and kind of, yeah, out to the sides, and rotate. There you go. You feel it?
Mm-hmm.
Okay, and then the other side. Good. And now we would do the glute stretch. Okay, so you need your legs at right here. And I'm going to do this to your knee, cross it over your leg, and you should feel it in your glutes. Okay?
Should I move this one forward?
Just until you stretch your glutes. And then you're going to bring your knee up to your chest, and this is going to get your piriformis. Okay? Piriformis was one of the muscles that we noticed in the assessment. It's kind of a difficult one to stretch, but if we don't, it can cause some problems. Okay? All right. And there you go. Okay? Good job, Tyler. And another one we're going to do is the psoas stretch. You elevate one leg, and you just push your straight leg back, and it's one of your deepest hip flexors by grinding forward. Tyler, can you get out of the way of that video?
Sure.
There you go. And you'll be like right there. You're stretching right here. Okay?
Okay.
So again, your hip flexors. There you go.
Oh, yeah.
Yeah. So we know that that's working. Okay? It's also really important, especially when you're training people that want to get stronger or lose weight or something, but have serious muscle imbalances. You have to explain to them that we need to do this first, or that an injury will happen. And especially with clients like Tyler who have physically active jobs. And one more video to come.